I don't believe I've done a video on this for a while, and I want to sort of update you on my philosophy about jawline definition. A lot of times when we think about the traditional way of thinking regarding the jawline, we think jowls. We think we got to get rid of this jowl, and that's the number one goal of making a jawline look better. The philosophy has really shifted over the last decade in terms of how we see the aging of the jawline. The initial thought is if we can improve the jowl, then we are golden. However, there is a difference that occurs over one's aging period that is actually more of an entire jawline and below the jawline concept. So we're going to talk about each of these positions, and then we'll talk about sort of how I approach this. So one is the jowl. That's the anterior jawline, what I'll call the anterior jawline. The second part is the shortening of the jawline, or the loss of the posterior jawline, or the mandible angle right here. And that's a newer concept. And the third is going to be neck bulk, which traditionally we thought of in terms of fatness or liposuctional problems, which has been radically changed now. So the concept of the jowl reduction for me has several ways that I address it. The first is I do some micro liposuction to reduce the bulk of the jowl. I can add a little fat to the anterior portion of this area, but principally the goal is to release a small ligament called the mandibular ligament along with other ligaments as part of a deep plane facelift, and then to elevate that tissue upwards with a traditional extended deep plane facelift technique as the principal mechanism, with the small adjunctive therapies, possibly a little fat graft, possibly a little microliposuction in the right patient to further address that entity. The second component is the newer idea of what is happening with the jawline. When we look at an older jawline, there's an effacement or a loss of the outer mandible, so the jawline looks short. It doesn't look just stubby and fat here, but you've actually lost the crisp jawline on the back side. So this outer portion looks blurred out, you don't see it, and it looks shorter because you don't see it. It just looks like a mass of fat where you just don't see it. Even in the thinner patient, you just don't see the angle anymore. So what we want to do is lengthen the shape of the jawline so that the jawline shape is now a longer mandible with a more defined outer mandible. That is also part of the lift procedure that I do, but I now have tailored the technique in a way that addresses this problem using several modifications. The first is that with my elevation, I wrap it around the bottom of the mandible so that I can create better definition back here rather than just overlying the mandible. In the past, I would just lift and elevate this over the tissues. You would get a very good jawline treatment, but you wouldn't get the result of the back posterior mandible, which we really want to define. The way that I anchor it now is I do a mastoid crevasse, which is I release a little bit of the parotid tissue going down into the base of the attachment of the mastoid. So this is an area that's very, very strong, tensile strength, and it allows me to push into that recess to create better definition, and that lengthens the jawline. And the third component is the bulk of the neck. Now, I've shot really independent videos of each of these parts, so I don't want to spend 30 minutes and go through all of it. If you look at my part 3 video series of how and why I reduce the submandibular gland, how I do it safely, how I do it effectively, you can hear more about that. But I'm going to talk to you a little bit about what I do with the submandibular gland is that I actually excise a portion of it that hangs. They've done MRI studies to show that that component falls. So when there's a bulk to the neck, not only does it make your neck bulky looking, but also, if you think about it, when I push into the neck like this, it actually defines both the anterior and the posterior jawline. So the submandibular gland sits sort of in the lateral third of the space. Now I also shave down digastric muscles. I also shave down submental fat. But all of these things that cause bulk of the neck, the majority sits actually inside the muscle called the platysma rather than outside the muscle. The traditional way is that you just liposuction all of that fat on the outside, but it really doesn't do anything when you do that. It also causes more problems, which is sometimes skeletonizing the muscles where especially if you're a younger patient and you're not actually doing any of the deep work, you're just doing liposuction or Kybella, you're actually going to get a skeletonization of the muscles where if you're not lifting that tissue, you can get a actually more premature aging where that muscle becomes more obvious sooner than later. The second issue is that if you're doing a facelift with it and you're doing liposuction, you're not addressing some of the deep areas, especially in a thinner neck, where you think, well, I'm just going to go and do some liposuction. The problem with that is when you skeletonize this area and you lift against a large gland, you actually see this gland show up. It becomes bigger. So that's why that idea of just liposuctioning and lifting is not good. If you look at maybe you've had it done, or if you look at your friends who've had a traditional lift with liposuction and they haven't addressed the gland, when you look at it from a 3/4 view, you'll see a circular ball right there, and that ball is a subnerve gland that has not been addressed, that has most likely undergone a lot of aggressive liposuction and a release that tethers the gland around it. So reducing that bulk doesn't just allow you to have a cleaner neck profile, but allows you to get a better jawline. Do I do that in every patient? No. I can pretty much tell who needs it by a quick exam with my finger. If I elevate the tissues and I see no redundancy and no bulk in that area, most likely that is just not necessary for you. But if I lift it, I still see a bulkiness there, it most likely needs to be addressed. And in younger patients, I don't even do the side lift. I just reduce the gland, the deep tissues, and everything sinks back up without even needing the lateral elevation. So this is just a new concept of jawline definition and what it means. It is paired with other treatments like eyelid rejuvenation, fat grafting to around the eyes. You don't want fat down here, but this area typically becomes empty. And I call it an upside down egg, which is, or the easier understanding is a triangle. So when we get older, the triangle becomes bulkier here and we lose the volume up on top. When I reduce the sides here and I widen the top, you get an inverted triangle, which is the triangle of youth. And so these are just general shape changes that help you understand something apart from just jawline definition. But of course, you want that definition across here, but adding a little bit of volume up here creates a harmony, not a bulky face, not a full face, but a harmony between the lower and the top faces, top portions of the face.